Hi, I'm Jerry Furlow, the owner of Family Caregivers, and I'm coming to you today to give you some instruction on how to properly wear a face mask. Because it's come to my attention from a few of our clients that some of the individuals that were in their home either weren't wearing a mask or not wearing it properly, and this scared them a lot. I think we're all a little scared these days with the coronavirus. So I'm going to show you how to properly put on a face mask and wear it during the visits that you have with patients. So bear with me, I wear glasses. So if you're a person that wears glasses, please take your glasses off. Okay, this is a mask, and in the top here, there is a piece of metal, and that metal actually is to form across your face, your cheeks, and your nose better. And there's elastic on either end, okay? All you simply have to do is take that, put it over here, and pinch the area of the metal around your nose. Take this part and put it over this ear. Take this part and put it over this ear. Okay, make sure that it's nice and fitting around your nose and cheeks. Okay, it's nice and snug. And pull this down around your chin. That will give you a good seal on either side here, down here, and across here. And as you can see, as I'm breathing, the air is going in and out. You can put your glasses on. If you're wearing goggles, and we'll soon be getting goggles in for everyone to be able to wear, you can put your goggles on at that point. And that's all there is to it. The reason that you want to wear it like this, okay, is these masks protect you against bacteria, viruses, pollution, and things such as that. I know it can be a bit uncomfortable while you're in a patient's home and you're having to breathe. It can get hot and stuffy, okay? Step outside for a minute if you need to. Take it off, take a deep breath, get some fresh air, and go back inside. But while you're with a patient, you need to be wearing your masks. You don't wear it down here. I know this is a little more comfortable, but you're going to be exposing yourself and the patients to the viruses or any bacteria, or any colds, any respiratory symptoms at all. So it must be over your nose. Pinch it nice, okay? And then you can go about and do your work. So thank you guys. Wear your mask. Wear your other PPE, okay? Use your hand sanitizer, okay? I'll be showing you more about how to properly wash your hands for those who may not have been instructed that or didn't know or didn't watch a video on it. Okay, so stay safe. Use your hand sanitizer. Wash your hands. And when you're done work, go home. Stay home. Stay safe. Thanks. Till next time. Bye-bye.